My name is Michael Schachter. I'm a physician, graduate from Columbia College, and also a graduate from Columbia College of Physicians and Surgeons Medical School in New York City. I am actually a board-certified psychiatrist, having finished my residency in 1969 and became board-certified in 1971. At the present time, I am the director and owner of the Schachter Center for Complementary Medicine in Suffolk, New York, and we have had a complementary and alternative medicine practice actually since 1974. Started out in Nyack, New York, and then moved to Suffolk in 1991. We have about 10,000 square feet in a modern office building and have about 35 staff people trying to work with patients of all types, with all types of diseases, patients of all ages, applying various complementary and alternative treatment modalities for them, including nutritional methods, nutritional recommendations, oral nutritional supplements, including vitamins, minerals, enzymes, herbs. And we also use intravenous treatments such as EDTA chelation therapy. We use intravenous vitamins and minerals. We have an acupuncturist, a chiropractor, somebody who works with mind-body medicine, and we try to work with patients at whatever level they're at, trying to look at them in a holistic manner and trying to prioritize whatever treatment modalities they need after going through diagnostic tests. After finishing medical school and going through my residency in psychiatry, I went into the Air Force for 2 years and was a director of an outpatient clinic at Biloxi Air Force Base, Keesler Air Force Base in Biloxi, Mississippi. After a 2-year stint, I came to Rockland County in New York State. Rockland County, by the way, is about 45 minutes from New York City. It's just above New York City. It's a suburb right across from Westchester County. And at that time, I took a job at the Rockland County Community Mental Health Center as a psychiatrist, first a staff psychiatrist, then head of the emergency service, then head of the head of the outpatient clinic from 1972 to 74. And it was around 1974 that I first became interested in complementary and alternative medicine, having known very little about it before that time. And it was really quite fortuitous that I actually became interested in it. And in fact, most of the interest in the various modalities of complementary and alternative medicine came as a result of various health crises within my own family. At the time, in 1974, my daughter, Amy, who is now 28 years old or 29 years old, at that time she was 2.5, and she had been stricken with cerebral palsy, and she had been attending the Helen Hayes Rehabilitation Center in Haverstraw, New York, for about a year and a half, having had occupational therapy daily to try to get her to be able to crawl on all fours. She was not able to do this. She could only move on her belly and couldn't get up on all fours. It was around that time, while I was director of the outpatient clinic in Rockland County, that one of my staff told me about some remarkable effects that they had had with vitamin E treating phlebitis and preventing pulmonary emboli, that is blood clots to the lungs. And I had never heard about that, and I asked where they had learned about it, and they told me that one of my staff psychiatrists had told them about it, and I asked if she would mind getting me that information, asking him if he could get me some information. A few days later, I found on my desk a book called Vitamin E for the Healthy and Ailing Heart by Wilfred E. Shute. And that was primarily a book about the use of vitamin E for heart disease. And of course, at that time, it was a total absurdity to think about among conventional medical practitioners or conventional medicine in general, to think at all of vitamin E as being useful or valuable for heart disease in any way. Now, of course, things have changed, and many conventional physicians have incorporated vitamin E and have actually done so for a few years. But at that time, it was considered ridiculous. Well, anyway, I went through the book, and it was very interesting, but even more interesting for me at that time was there was a chapter on the treatment of brain-damaged children with vitamin E, and in that chapter they referred to a study in Chile which had been done with brain-damaged children, including children with cerebral palsy, with vitamin E, and with remarkably good results. And it seemed to be a totally non-toxic supplement, and I thought to myself, why not try it with my daughter Amy? And so I cautiously started her on 100 units of vitamin E a day, and within a few days she began to show some signs of increased activity, of looking more alert. And a week or two passed, and then on the third week, sometime during the third week, I decided to raise the dose to 200 units a day, and I did that, and I was kind of sitting reading in my chair in my office in my home, and she was kind of playing on the floor, and all of a sudden she got up on all fours and started rocking back and forth. And her mother and I pretty much burst into tears and were just taken by what had happened. And it was interesting that her mother at the time was pregnant with our third child and was extremely exhausted. And I reasoned she would go to sleep for 11 hours and wake up and have to go back to sleep again. And I reasoned that if Amy seemed to have such a dramatic response to vitamin E, because I had read that vitamin E was very helpful for fatigue and so on, and very helpful in pregnancy, I again thought to myself, well, perhaps Peggy needed to have vitamin E also, and I suggested that she take some, and the next day she got up after 7 hours of sleep and walked 2 miles, and it seemed to also have a miraculous effect. So here I had 2 miraculous effects on my own family members with vitamin E, which I had known nothing about from medical school or residency or internship. And I wondered to myself, what more don't I know about this? This is really amazing. And subsequently, the next few months, I met Carlton Fredericks, who was a pioneer in nutrition, who had radio shows and actually was persecuted for some of his views. I think it was back in the 50s, but at that time was actually very popular in New York on the radio. And I met him, and he introduced me to the concept of orthomolecular psychiatry. And this was the notion that you could treat psychiatric problems with nutrients and natural substances. Ortho means right or direct or straight, and molecules refers to the molecules surrounding the cells of the brain. And if you could actually create an optimal environment for those cells, you might be able to actually improve patients with psychiatric problems. And so I began to start, I read about the work of Hoffer and Osmond, who had done some pioneering work back in the 50s using high doses of niacin and B6 and vitamin C for schizophrenia and other conditions. I started reading about hypoglycemia, and I began to start to work with some psychiatric patients, giving them these programs, and to my delight, these patients often began to improve. And not only did they improve in their psychiatric conditions, but they frequently improved in their various medical conditions. They would come back, they would say they're no longer fatigued, they have a lot of energy, their allergies were going, they didn't seem to get infections so frequently, their arthritis was better. And around that time, I did something which is very unusual in medicine. Instead of differentiating, I de-differentiated, and instead of wanting to see only psychiatric patients, I began to say, well, maybe I can help other patients as well. This was then accelerated by some more problems in my family. My father, who was a golfer and liked to play golf a lot, had developed a condition called intermittent claudication, which means there's a blockage of arteries to the legs, resulting in some pain when walking, because as you walk you use up more energy and you need a bigger blood flow, a greater blood flow to the legs, and if your arteries are clogged somewhat, you can't get it and you develop pain from insufficient oxygen to the muscles. And it was around that time also, as I said, I was getting into nutrition, and I heard about chelation therapy, which I'd never heard of before. As I looked it up, I recalled that maybe there was an hour or so in medical school of the 4 years that they mentioned removing heavy metals with a chelating agent. the word chelate comes from the Greek word chelos, meaning claw, and it refers to the claw, or the pencil-like, claw-like action of an organic molecule that grabs a mineral, and in the case of chelation therapy, it removes that mineral from the body. And I was hearing that people were using it for cardiovascular disease of all kinds, and at that time I referred my father, when I heard about it, to somebody I had just met recently who was heavily into nutritional medicine, Dr. Warren Levin of New York, and my father went to him for chelation therapy. And again, much to my delight, and certainly his delight, at the end of a series of chelation therapy, he not only was not having pain in his legs, but he was able to walk around a whole golf course without having any pain, and he was, of course, very, very happy with those results. That was a very important experience for me, and got me interested in chelation therapy, and I decided to go to some conferences, a conference sponsored by an organization called AMP, American Academy of Medical Preventives, which taught physicians about chelation therapy, and consisted of many physicians who were doing it. And so I got my training, and I began to start to see patients with cardiovascular disease. The next major hurdle was a much sadder one, and that involved my mother. Back in about 1975 or so, my mother developed a brain cancer, one of the worst you possibly can have. It's called a glioblastoma multiforme, and this is a disease that usually has a survival from the time of diagnosis of 4 to 6 months, and she was deemed inoperable, and that there was nothing that could be done. At that time, I had seen a videotape within a few weeks or a month of around the time she was diagnosed, and it was called World Without Cancer, and it was not a videotape, it was actually a slide presentation, and it had to do with amygdalin or laetrile for treating cancer. And I wondered if there were any alternative therapies that might help my mother. So I took my partner at that time, the late David Schenken, who was kind enough to allow me to take off time from work, and I took 2 months off from work, and I kind of scoured the country. I went all over the country, and I went to Mexico to see if I could learn some things from my mother. I visited Andrew Ivy in Illinois. I went down to the Mexican clinics in Tijuana. I visited Roy Davis in Florida to learn about magnetic therapy. I visited the Burton Clinic. I visited Dr. Ravici. And so I began to have a background in all different types of alternative cancer therapies. And I put together a program for my mother, including carbamazine and Hoxy and Burton program and Laetrile and many other things, hydrazine sulfate. And unfortunately, as it turned out, it didn't turn out happily. Ultimately, although she seemed to respond briefly to some of the modalities, she ultimately died. This was, of course, very sad, but at the same time I felt that the 2 months were very valuable to me because I learned a lot of things, and I talked to cancer patients who had gotten a great deal of help from these alternative methods, and there was just nothing about them in medical school, and nothing about the whole use of nutrition and nutritional supplements for cancer patients. Soon I was getting calls whether I would treat patients, continue treatment with Laetrile for them, and I began to do that, and I have actually continued to use amygdalin or Laetrile for cancer patients who have obtained the medication themselves, and then we have administered it to them in our center. As I've gone through the years, I realized there were many modalities in complementary and alternative medicine that are useful, and come to realize more and more that it's best to try to work with patients at many levels, attacking the problem in different ways. We start with lifestyle. We want to try to help patients improve their lifestyle and get toxic substances out of their bodies and stop introducing toxic substances in their bodies. So, for example, we give a patient, all of our patients receive a void list usually during the first visits, and we tell them we don't expect them to do everything 100%, but we'd like them to avoid as much as possible exposure to fluoride, to chlorinated water, to caffeine, to sugar, to artificial sweeteners, to various other artificial additives to foods, hormones, pesticides, various other negative things in the environment. We ask women, when possible, to avoid the synthetic hair dyes, and if they have to use them, try vegetable dyes. We ask people to avoid aluminum-containing antiperspirant deodorants, and to use only deodorants which do not contain this aluminum, which can be very toxic. We also ask people to, of course, stop smoking. Reduce any caffeine, reduce sugar, etc. Try to eat whole foods, organic when possible. We do various types of laboratory testing to determine whether there may be evidence of, especially if a person has gastrointestinal symptoms, we try to do comprehensive stool analysis, parasite evaluation, see if there's any parasites in the stool. We check for heavy metals. We do a test, for example, a provocative test for heavy metals using a oral chelating agent called DMSA. We have a patient take that. We then have them collect the urine for several hours and then submit it to the laboratory. And we look for lead and mercury and cadmium, aluminum and arsenic. We look for sources if we find that they're elevated, and frequently one of the main sources is mercury amalgam fillings in the mouth. Sometimes we will recommend that patients will actually have those fillings replaced with non-mercury containing substances, since mercury does enter the system, and for many people a tremendous amount enters as they chew their food. And this goes directly into the system and can have very adverse effects on the immune system and on virtually all systems in the body. So we look for toxic metals. We also look for nutrient deficiencies or suboptimal nutrients. So we may do tests for example, red blood cell minerals, looking for deficiencies in magnesium and zinc and manganese and so on. And we supplement with all of these things. For our cancer patients, we use lots of other extra supplements, such as relatively high doses of proteolytic enzymes, which tend to dissolve coating around cancer cells and help the body to attack the cancer. Other tests on cancer patients would be to measure certain general nutrients, vitamins and other minerals, but in addition to that, to look at their serum coenzyme Q10 level, which is something that is unusual and seems to be CoQ10 seems very beneficial in cancer. We want to make that dosage optimal. We also treat our cancer patients with intravenous infusions of vitamin C and amygdalin, as I mentioned, sometimes glutathione and other B vitamins and other nutrients at times. And of course, we do EDTA chelation therapy for patients with cardiovascular disease, and we find that this is one of the most successful treatments that are available for coronary artery disease and all forms of atherosclerosis. Recently, we've added to our center a new technique, a new treatment modality, which is extraordinarily beneficial with virtually no side effects, and that is a treatment called external counterpulsation therapy. And this involves having cuffs, like blood pressure cuffs, around the legs, around the thighs, around the lower abdomen, and these cuffs inflate and deflate rapidly, timed to the cardiac cycle, so that when the heart relaxes, these contract rapidly sequentially from lower to upper, increasing the pressure in the aorta and in the coronary arteries. And basically by doing this, it seems as if it stimulates the formation of new blood vessels, and a number of studies have shown that external counterpulsation is a very powerful and very safe treatment for coronary artery disease of all kinds. Even Medicare has begun paying for it. Unfortunately, they only pay for it when the patient is very severe and if they're not considered a candidate for invasive techniques, which to me is doing things totally in the wrong way. We should be doing everything possible non-invasively and all the safe things, and when they fail, then one might consider some of the more invasive procedures. But unfortunately, a lot of the payment considerations are controlled by men, by quote experts in cardiology and cardiovascular surgery, who have vested interests in seeing that some of these more invasive and more expensive techniques remain in the forefront of consciousness of the public. and therefore this some of the less invasive and, in my opinion, more beneficial and safer treatments are generally not given the attention that they need. I have also, I'd like to mention also, I mentioned the organization AMP earlier. That was the organization that teaches physicians how to do chelation therapy, EDTA chelation therapy for heart disease. And several years ago, that organization changed its name. It's now called the American College for Advancement in Medicine. I'm very happy to say that I have been involved very much in the organization for many years. I've been either on the board or medical advisor, and including on the board as president, vice president, president-elect, probably for probably over 20 years. There were a few years I think I was off the board, but most of the time. And this is a wonderful organization that plays a major role in teaching physicians how to do this kind of therapy. I've also, for the past 6 years, I've been president of another organization called the Foundation for the Advancement of Innovative Medicine, or FAIM, and this is an organization that consists of practitioners and patients and suppliers of health food or suppliers of health products. And the main thrust of this organization and its sister organization, FAMED, is to teach the public about all aspects of complementary alternative medicine, and also physicians, and even more important, to try to establish an environment so that people have freedom of choice in healthcare, that they have access to and have a freedom to obtain knowledge about all aspects of things, all aspects of care, rather than just the limited conventional alternatives, which frequently people are limited to. And this is a great concern of ours. We have also been very concerned about physicians throughout the United States who have had their licenses attacked because they have not stuck to the conventional modalities or conventional treatments, including primarily the administration of drugs and surgery, and cancer, radiation therapy, and chemotherapy, and have moved away and focused on nutrition and nutritional supplements and acupuncture and various stress management, mind-body techniques, etc. And as a result of that, they've been brought up on charges, and some very, very well-intentioned and very talented physicians have lost their licenses, and it's been a terrible loss to the public and to society, because these people have suffered so much and have not been able to carry on their work in a positive environment. So FAME has been helpful, for example, in passing a law in New York State, one of about 11 or 12 states now that have laws that give physicians some degree of protection when they do complementary and alternative medicine. But clearly there is still a long ways to go, and even with these laws, right now we have a situation in New York State where there are at least, I think, 4 or 5 physicians under attack for doing complementary alternative medicine, even though we have that law. We thought it wouldn't be long before they tried to test the law, and right now they're in the middle of doing that. We're doing everything we can to try to help those physicians out that have good practices and who've had, most of the time, have had no complaints against them by patients, but mostly complaints by insurance companies who don't want to pay for these services, or sometimes from other envious physicians, or sometimes from other practitioners, or even pharmaceutical companies, we think sometimes make complaints. But mostly I think it comes from insurance companies and other doctors, and only rarely from the patients themselves. Another area that we have found to be very useful, which is tremendously underutilized in conventional medicine, is the whole area of bioxydative medicine. Bioxydative therapy, I think of it in terms of pretty much 4 general techniques. One would be hyperbaric oxygen, where a person breathes in high concentrations of oxygen in a pressure chamber over short periods of time. And this is a treatment we don't currently do in our office, but it seems to be very useful for patients with, and approved for patients with carbon monoxide poisoning and other conditions like rare conditions like the bends that one might get from being in deep water and rising too rapidly. But it also seems to be useful for patients with various brain disorders such as cerebral palsy or multiple sclerosis and other conditions as well. The other biooxidative therapies, there are three others that we think about, and all three of these we do in our office. One of them is called intravenous hydrogen peroxide therapy, where we use very dilute concentrations of hydrogen peroxide and administer it intravenously. It's in the vein over a period of usually an hour, usually 1 to 2 treatments a week, and this can be used to stimulate the body's immune system and stimulate the antioxidant enzyme systems in the body, which are involved with detoxifying, cleansing the body, and helping people to overcome chronic diseases. The common pathway of many of the chronic degenerative diseases involves the formation of free radicals, which are highly reactive oxygen species that attack cell membranes. And the administration of IV peroxide or these other biooxidative therapies, you would think they are pro-oxidative and they would be contraindicated in people who already have too much oxidative stress, but the whole key here is dosage. And if you administer the proper dosage, you may get a temporary slight increase in oxidative stress. This then is followed by a reaction of the body stimulating the production of antioxidant enzymes and improving immune function, and so there's a net improvement in the patient. We also do something called ultraviolet blood irradiation. It's also called photopheresis. It's also called photooxidation, and this involves taking some blood, usually only about half a pint, out of the bloodstream and passing it through exposing it to an ultraviolet light source. The photons get into the red blood cells and change the red blood cells. The blood is collected and then it goes back into the bloodstream using past the ultraviolet light source again, and this results in some beautiful changes again in the immune system and in killing chronic viral or chronic infectious diseases, and is very effective. And the final biooxidative therapy is the use of ozone therapy, and this can be done either as a major autohemic therapy where you collect blood, mix it with ozone, put it back in the body, or in some cases use intravenous ozone done carefully and with the right dosage. There are places where this is done with great benefit, although this is more controversial and some people feel that this is somewhat more dangerous than the autohemic therapy. But if it is done properly and correctly, this can be a very powerful, quick, and easy to do therapy. One of the areas that I have been very concerned about involves the conventional cancer treatment for some of the major cancer therapies, such as breast cancer and prostate cancer, and the automatic utilization of toxic conventional therapies such as radiation, chemotherapy in breast cancer automatically, even though patients after surgery may show no evidence of any cancer being present. And this is of a great concern to me because of the damage that these conventional therapies may do, not only acutely but chronically over periods of time. And I think that we really have to look very carefully at these therapies. I think that sometimes what happens is these become the standard of care when there really isn't very much good information, especially in terms of improving the survival of patients. Often cancer has been looked upon as a disease where you measure its progress by shrinking tumors, and if you shrink tumors, it's considered to be a positive therapy. But since there's virtually no correlation between shrinking a tumor and actual survival of the patient when you use these conventional modalities, I think that people need to be informed about this, and there needs to be a very careful evaluation and reevaluation of some of these conventional therapies, and at the same time an evaluation and reevaluation of some of the non-toxic complementary and alternative therapies, which appear to be very beneficial for cancer patients in our experience.